Araushar.
And title position?
So I'm a physician. My title is a medical investigator at Southern Nevada Health District.
So we just received this release today saying that there's a significant increase in the reported cases of hepatitis A. Why should people be worried? Should they be worried about this?
So since 2017, there's been an increase in a number of hepatitis A cases across the country, especially in people experiencing homelessness and people who use drugs. So starting between between January and May 31st, 2019, we have 37 cases of hepatitis A compared to 17 cases the same period last year. So this is an increase. It's not something that people need to be too alarmed about, but it is something that we want to let people know, because the main people who are at risk for hepatitis A in the current outbreak are people experiencing homelessness or people who use drugs, especially in unhygienic conditions, such as homeless encampments. So we've been working to try and target these groups for hepatitis A vaccinations and to really just spread the word so that people who are at risk can get vaccinated.
So when you mentioned that 86% of people who use drugs, is this contaminated needles?
So hepatitis A is spread through the fecal oral route. So basically, someone uses the bathroom, they don't wash their hands properly, or maybe they're living in a situation where they don't have running water or toilets, such as in a homeless encampment. And then basically they're eating food or touching their mouth and infecting themselves this way. So it's not the drug use itself that is causing the hepatitis A transmission. It's mainly has to do with hygiene and where these people are living.
The cases that are not involved with, not associated with homelessness or drug use, where have you seen those cases?
So in this current outbreak, they've almost all been either people who use drugs or people experiencing homelessness or their close contacts. So some people may, they may be friends or relatives of someone who's homeless, and those people may sometimes, eat together or go into their homes, and that's the main way that the people who are not homeless or have not used drugs are getting infected.
Have you seen any of these cases become associated with death and fatalities?
I can't report at this time on the specific clinical circumstances, but what we can say is that the majority of these people were hospitalized.
When you say 86% were people who use drugs, 65% were among people experiencing homelessness, do we know the number of who were both using drugs and experiencing homelessness?
We're not reporting on. We're trying not to give. Let me rephrase that. Most of the people who are homeless are also using drugs, and a lot of the people who are using drugs are also homeless. So there's a significant overlap. I can't tell you off the top of my head how many people had both.
So this is for all of Clark County. Are there any specific areas that we've seen more that people should be aware of?
At this time, we don't want to report on exactly the specific locations. In the future, you could possibly reach out to Stephanie regarding that. But we're seeing clusters that tend to go around, homeless encampments. So basically where there's large people, living without homes and often in sort of unsanitary conditions, we're seeing cases from these areas.
Can you just give a breakdown of what is hepatitis A? What are symptoms? How is it spread? Just 101.
So hepatitis basically means inflammation of the liver. And there are several different types of viruses that cause hepatitis. Hepatitis A is a specific type of virus that causes hepatitis. It is transmitted, like I said before, through the fecal oral route. So someone goes to the bathroom, they don't wash their hands very well. They either, they're handling food or they're touching, they shake hands or something with someone else touches their mouth, they can transmit it that way. So it can take, so the incubation period can be for about about a month. So someone's exposed, then maybe a month later they start developing symptoms such as fatigue, fever, nausea, vomiting, abdominal pain. People will often have really dark colored urine, light colored stools. And when they, sometimes people can be infectious before their symptoms start. So they don't know they're sick, and they can be exposing other people.
So can you get a vaccination? Will that help protect you?
Yeah, thankfully, hepatitis A is one of the types of viruses where we do have vaccinations against. The other hepatitis virus that's preventable via vaccination is hepatitis B. But for hepatitis A, we recommend vaccination in people who are at risk, such as, if people experiencing homelessness, people who use drugs. There are some other categories of people who are also at increased risk, such as men who have sex with men. If you're traveling to an area, where hepatitis A is endemic, getting vaccinated before you travel, that's good. And since 2002, in Nevada, we've been vaccinating school children as well against hepatitis A. So, hepatitis A vaccine is an incredibly effective vaccine. Unfortunately, most of the people who are affected in the current outbreak were born before they started doing the childhood vaccinations. But this is another important strategy as far as increasing herd immunity in the community.
Are all the patients adults or any children?
In the current outbreak, they're all adults.
Can you get it if you've been vaccinated, and has anyone gotten it who has been vaccinated?
Like with all vaccines, some people will not mount an immune response when they get a vaccine, so they'll get vaccinated, but they won't necessarily produce enough antibodies to prevent it. In this case, everyone who has gotten ill in the outbreak in this current outbreak, the people who've been infected have not received vaccinations. The hepatitis A vaccine is very effective, though, so the overwhelming majority of people who get hepatitis A vaccine will be immune to it.
Short of raising public awareness on this and just letting people know about it, is there anything specifically that the health district can do proactively to kind of curb this?
Sure. So one of the most effective strategies in states that have experienced these sort of outbreaks in the past has been trying to target people who are at risk for this disease and vaccinating them. So especially going out into homeless encampments, when these individuals go seek care at healthcare facilities, recommend